All right, hello everybody. This is the special after seminar Q&A recap from the event that we did on Saturday. So I literally have my phone here, and I'm going to be going through the text messages that you all sent during the event. And I know some of you are already well into the little 6-day challenge, little 6-day plan that we gave you. So I'm going to cover a few questions I've been getting there. So I'm literally just going to go through these. I'm actually going to go through all the original ones too, because I know I went through them fairly quickly at that event. So the first question I got was, how can someone work on their midsection where a lot of fat hangs out? So I'm not sure if we're talking about like kind of the traditional like beer gut here or maybe a menopause belly, but the nutrition plan that I went through, which is a quick recap, is going to be super low carb, low to moderate protein, and super high fat would ultimately address that. Now, in some cases where that type of dietary plan does not work, then what you're looking at is there's probably some toxic accumulation going on in the body, because toxins are fat soluble and tend to hang around the midsection for people that have that going on. Another question was, can Lyme's disease benefit from my work? And the answer is absolutely. Again, it's about getting down to the cause of the problem, and people that have Lyme disease respond very well to chiropractic, to this type of nutrition program, and also typically they'll need some advanced supplementation too to get their body healing well. But you really don't necessarily cure Lyme's disease, but you can absolutely get it into a state of 100% remission, which is excellent news for people that have suffered from that, because the medical model has no idea how to treat it other than throwing drugs at it and many antibiotics, and that's just not good. So I did answer this question, about probiotics at the seminar. Remember, there's many different types of species in your gut, so it's important to, if you're going to take a probiotic supplement, to be rotating and cycling through different probiotic supplements with different bacterial strains. And then make sure you're doing fermented foods on a regular basis. But you can also test your need for probiotics. So, again, my motto is testing, not guessing. So I will always say that with an answer if there's something that can be tested there. My mom has had sciatic pain for years. It comes and goes, and she's seen doctors, but it hasn't helped much. I never understood the root cause. Can you please go over it? So the root cause of sciatica, the sciatic nerve exits out of the nerves in your lower back, the very lower back. There's 3 areas that it exits out of. So that shifting or arthritis or compression or damage or, in the spine in that area can absolutely cause sciatica. There's also something else that can complicate it called piriformis syndrome. And piriformis syndrome will be when the muscle is also pinching off on the nerve too. But that's typically not the primary cause. That's typically a secondary cause. So x-ray is done by a good chiropractor, which I happen to know one, if that your mom needs one. Or if she's in an area not here, like a different part of the state of the country, I'll have you text me or email me, and I'll give you a name of a good doctor in that area. So sciatica, very easy to see heal in a chiropractic office honestly, very easy. So better for cooking. The only one we use is coconut oil for cooking. That's the only one I use in my household. No other oil is really stable or have the proper, flavor, for that. So coconut oil is the only one you want to be using with cooking. So how do you test for ketones? So I did talk about this a little bit during the seminar, so remember the slides are going to be attached to this same email here. But urine you can do for the first couple of weeks, and see how you're doing first thing in the morning, and I would also do it right before you go to bed. But the most accurate is blood testing, and you buy a ketone, a ketometer basically, or a ketone meter to test for that. So, and this goes along with it. How do you test your ketones in the morning? So again, the urine or the blood strip would be the way that you're doing it. I got another question here that said the line was too long, so I wasn't able to make an appointment. Is it still not too late to make an appointment to become a patient here in your office? And the answer is absolutely not. So again, if you were at that event on Saturday, you were most likely referred by one of my patients. So I talked about the offer of a normal price coming in of being normal is $220 for my new patient assessment and everything we do in that appointment. But our event or referral price is $88. So if you call my office, which is 919-790-8054, and just mention you were at the event and that you'd like to come and make an appointment, it would be $88, which would cover everything that we would do there that I mentioned. And you'll see a slide on it again too if you just want to refresh everything that I cover on that. So again, sucker for bread. You just got to get rid of it. Don't be addicted to it. I had a little funny joke about that. Hopefully it was funny. ML protein has stevia, and I don't like it. So we did start carrying a bone broth protein, which I talked about on Saturday. That is unflavored, so there's no stevia in there. So that would be one I would really safely recommend. You mentioned Terra's grass-fed whey. Grass-fed whey is definitely better. So I would just be really careful about the extra ingredients in there. So if you want to send me a picture of the label to my cell phone, 919-561-7350, whoever sent this question, I'll take a look at it for you. So I debunked the blood type diet. It's just not true. Ghee is clear. What is ghee? And the answer to that is it's clarified butter. So it's just a specially processed butter, for lack of a better term. Where can you buy raw cheese? Kroger, Whole Foods, Farm to Fork meat. Okay to fast and anti-anxiety, antidepressant. So regarding any medication, if you need to eat something in order to take that medication is vital for you not dying. Make sure you eat a little something during the quote-unquote fasting period. So yeah, just don't mess around with that. Now, again, I go back to figure out what's the cause of why you're on that in the first place. That's a better question. And, we should work on solving and getting rid of that. Okay, so organic non-GMO soy, absolutely not. Soy is way too much of a... now, sometimes they're in supplements, like organic non-GMO soy is sort of like an emulsifier or just a way to help deliver the nutrients. And that's going to be very minuscule amounts, and I think that's okay. But as regarding eating it on a regular basis or having soy milk and stuff like that, no way, because it can really has the potential to drive your hormones out of balance. So skipping meals. So if you're vegan, vegetarian, don't eat eggs or fish or meat, can I do this? So yeah, I mean, honestly, I challenge people that are vegan or vegetarian, and just really why. Now, if it comes from a philosophical or just care for animals standpoint, whatever word you want to use there, I totally respect that. But from a health and wellness standpoint, there's absolutely zero research showing that we should be avoiding animal products. In fact, this should be predominantly what our diet is made out of. Remember, our species, it was predominantly, before modernizing, was a hunter-gatherer, which means that farming crops and even anything that would really be farmed, that would take a long time to grow before you'd harvest it, would not be something we would naturally eat, but we would, be eating cows and chicken eggs and things like that, and find whatever we could find foraging. So from a health standpoint, I'd challenge you on that. From a philosophical standpoint, I totally respect it. So, but yes, you can. We have many vegan and vegetarian options. It's definitely harder with vegan. It's much, much, much harder with vegan. Vegetarian's not as hard for that. So why is it the belief that skipping meals makes your body store more fat? So from where this comes from is that if you're gonna, where people say they skip breakfast and you're more likely to store fat. When people skip breakfast, just because they're skipping breakfast, they oftentimes still make up for it as the time goes on. So they might not eat breakfast before they leave the house, but then they get to the office and they're having donuts and whatever crap they can find there, or slugging sodas. So they might have skipped breakfast, which you could confuse as, well, I'm intermittent fasting, but then you're shoving a bunch of bad food in your body, and then you also may eat late into the night. So intermittent fasting is just it's a consistent, so you don't just do it one day out of the week. It's a consistent way of eating that provides a new rhythm and a new routine for your metabolism. So that's one of the big differences, is that it's cyclical and it's consistent. So if you just happen to skip breakfast and then do all kinds of bad stuff, you're gonna definitely it's not the same as intermittent fasting. You're gonna gain weight. On the 6-day challenge, so that's what's going on right now. Can you have bulletproof coffee? I'm saying no for right now. And if you want to just have plain coffee, I think that's going to be okay. But even if you can go without coffee, I'd recommend it. Just give your body a chance to heal from all kinds of things as you're stripping it down, and it's going to be a nice little way to detox too, from caffeine especially. So is there a limit on the fat intake? No, there's no limit on fat intake. Only as much as when you aren't hungry, well, then don't eat. So I got a few texts saying yesterday that I'm not hungry and it's time for my third smoothie, like the 2 or 3 o'clock one. Should I still have it? And no, if you're not hungry, then don't eat it. Okay, so let's start listening to your body and trusting it that it's going to give you the right cues that when you should be eating, when you should not. So another question was modified options for the exercise, and so we have that built into the Max T3 program in general, which means it's if you can't handle impact or not able to do squats because of knees or hips or ankles or joints or whatever that is, there's still ways to do that. And then the other question was the 88 per person of the initial consult, and the answer is yes. Now if it's a child and they don't need as much testing done, then it would be potentially a little bit cheaper than the adult there, but it would be 88 a person or maybe a little bit less. Okay, let's see here. So avoid pig-based products. Why should we do that? So the reason with that is that most sources of pig or pork are really toxic, and toxins cause fat buildup. So remember, toxins lead to fat buildup, and you wouldn't want to be making all these healthy changes and having pork like crazy, and then that be the reason why you don't get the results that you want. So just in general, you want to avoid pork products. Now, when you get to the weight that you want to be at and the level of health that you want to be at, you can usually get away with it. So, then go for it. But until then, I would just highly recommend dropping it all the way out and all the way down. Bear with me 1 second here. So if you're missing if you're missing having chronic pancreatitis or missing your gallbladder, there's a supplement called LV-GB from Designs for Health, and it's a really good one. So I actually have one bottle in my office right now. So if that's you and you're a patient, you can pick it up. But it has ox bile in it, and ox bile is very similar to human bile. So you would eat that before you would eat a fatty meal, or in this case, any meal you would have, and it would help you pre-digest and break that down. And then somebody asked if my service is covered by insurance. So this is always a funny question for me. And I'll kind of break it down. In fact, I should do a whole video on this just by itself. But in short, insurance companies' primary goal is to not get you well. If it was, you would have been well a long time ago, or you never been not well. An insurance company's number one goal is their profit and making their shareholders happy, not your health. And so to expect that a program and a system that is not set up to help you be healthy and pay for things that are actually things that are going to make you healthy, then you have to really realize that your insurance company is not responsible for getting you well financially or otherwise. So are my services covered by insurance? Sometimes, a little bit, yes, but I would say 90 to 95 to 98% of people actually end up choosing and prefer that we are out of network as a healthcare provider, because when they realize number one, how expensive their insurance actually is, because it costs more with chiropractic the majority of the time, or B, when they find out the restrictions on their coverage, and they're happy that I'm not a provider in their network, because then I have to follow their guidelines and regulations. So for example, let me just give you one example. So if you're on your insurance plan, they only cover 20 visits a year for chiropractic. Well, what if you need 30? Or what if you need 50 or 60? And so what that would mean is that any provider that is in network and contracted with your insurance company would have to basically cut you off at a point before your body could actually be healed or corrected. I mean, it's kind of like imagine if they only covered 30% of the procedure, the surgical procedure you were doing. Like, it was enough to open you up and like move things out of the way, but they didn't pay for you to get closed up and get sealed back up. I know that's a weird example, and it's obviously that's not how it works. But if you think about if it wasn't enough to get the job done, like how is it going to be successful for you long term? So insurance companies can pay for you to get out of a tiny little bit of pain. And even though they say they cover 20 visits in a year, they typically don't. They'll reject the claims before it even hits that point, unless you're just like crippled, which most people aren't. They're not coming into a chiropractic office and they're in that bad of shape. So we have a really affordable private pay structure in cases like that, which is why, again, the majority of people are happy that we're not a network, and they actually would choose and would rather pay private pay than pay insurance. So insurance companies they suck, and it's just the way it is. And so sorry. Can we have snacks between the smoothies during the pre-challenge? I don't recommend it, and you shouldn't need it. You shouldn't be hungry in between the smoothies. Like maybe by the time it gets to be the smoothie, you should be hungry. But if you're getting hungry in between the smoothies, your body is way messed up. And also you're not doing enough fat in your smoothie. So you should be doing more coconut milk, or if that's not enough, then you should be putting some avocado in there. But you should not be getting hungry in between those smoothies. So in fact, I just had my third one of the day, and I couldn't even finish it all. So I'm going to have to wait and kind of finish it when I'm a little bit, before I go into the office, we'll be a little bit more hungry. Okay. So when you are calculating how much protein you want, should you be going off your current weight or your target weight? And that's a great question. You actually need to go off your current weight. In some cases, being too much under protein, especially if you really have a lot of weight to lose, your body might struggle a little bit. And I know that seems a little bit counterintuitive to what I've said from the seminar and other talks there, but just know that you want to go off of your current weight. So your protein, as you lose weight, your protein content is going to change like a little bit at a time as you start dropping weight, which is good. All right, it means it's working. So, and then somebody asked, like, are these times for the shakes strict, or can I wait a bit? Yeah, and so again, listen to your body. We put 4 on there though for just people who are used to eating regularly, but you may find that you don't need 4. So don't eat a smoothie just to eat a smoothie. Okay, so yeah, again, it goes back to, like I said, listening to your body. Okay, awesome. So right below this, I'm going to put a video for just some challenge things, some 6-day challenge things specific, just to make sure, because I know I'm getting some questions on that too. So again, hope you all enjoy the seminar, and we look forward to seeing you if you're not a patient in the office or at future events. So God bless. Peace out.